Welcome to our virtual world. We are Connect the Dots, and in close collaboration with medical specialists, we have developed the virtual training program, CTD Health. Here, healthcare personnel can practice medical skills, interdisciplinary interaction, and develop necessary communication skills in a safe learning environment without putting the patient or themselves at risk. Training in VR is realistic and immersive, and research shows that it is also performance enhancing. Compared to traditional simulation training, VR removes distractions such as limitations in physical surroundings and performance anxiety in role-playing in front of spectators. The patient and professional content are emphasized, and studies show an increased learning outcome when using VR. In our virtual world, healthcare professionals can train whenever they want, as often as they want, and with whomever they want, efficiently and without expensive courses or travel expenses. The key to good patient safety is early detection of and response to worsening patient conditions. Our application is designed to support every step in the chain of prevention, so that institutions can make sure that employees in direct patient contact through frequent training in VR have the ability to uncover and follow up on worsening somatic health conditions. Education. The first step in the chain of prevention requires that healthcare personnel have sufficient basic knowledge. CTD Health therefore offers training on basic skills such as measuring pulse. During training, it is possible to alter the patient's vital parameters in order to, for example, learn to tell the difference between a pulse of 45 and a pulse of 160 beats per minute, monitoring. The next step in the chain of prevention is about systematic registration of observations and measurements carried out to form a basis for comparison for future measurements. In our application, skills such as ABCDE and News 2 can be practiced. Recognition. Recognizing important changes in the patient's values is the key to detecting deterioration as quickly as possible. Trainees in CTD Health compare their recently measured values and News 2 score with habitual state and are encouraged to reflect upon the implications for the patient's state. Call for help. When is it necessary to contact someone, and if so, who should you contact? This question is essential in securing patient health. In our application, trainees are challenged on this question regularly to build expertise and confidence on the subject. Action. When the patient's health situation requires the involvement of others, the eSPA framework for communicating is critical. eSPA ensures that all necessary information is passed on correctly and effectively so that the correct patient treatment can be put to work. For professionals, unskilled, and students, CTD Health is a training tool for professional, unskilled, and students. Unskilled workers will gain necessary knowledge by practicing steps 1 and 2 in the chain of prevention, while professionals, such as nurses, are able to refresh their knowledge and practice scenarios that require collaboration with other parts of the health service, such as the emergency room or 911. For students, CTD Health will function as an ideal training arena for new knowledge. Research shows that training in VR is both motivating and provides better outcomes than traditional training. Since there is no limitation to training opportunity, alone and in teams, health personnel become more confident in their own skills, are quicker to detect changes in the patient's condition, and become better at handling different patient cases. Focus on learning. Reflection on and feedback on one's actions is important for the learning process. In CTD Health, users are provided feedback on, for example, order of examinations, whether measurements are correct, and decisions on further care. After completing a scenario training session, the team meets in a debrief room to reflect on their own performance. To facilitate the learning process, The training program has built-in questions to trigger reflection on professional results and interdisciplinary communication. Confidence and mastery. Managers must be confident that employees have the necessary competence to handle assigned tasks. In our web portal, CTD Portal, managers can get an overview of registered VR headsets and access to anonymous user data from training carried out in CTD Health. The information provides insight into how often employees are training, what skills they are practicing, and the results of the training. That way, managers can encourage training in areas where weaknesses have been identified and applaud good effort. Senior Advisor at the Norwegian Directorate of Health, Anna Kristen Ile-Melby, said this after testing CTD Health. My experience with CTD Health was that the training situation was so realistic that I felt I was training on a real person in a real environment. I was surprised at how lifelike this was. I strongly believe that this will supplement today's traditional training methods and that it can enable more people to train more often. VR technology can be an important contribution to increasing competence in the health service.